Hi, I'm Komandoor Srivathsan from Mayo Clinic in Arizona. Today I had the opportunity to present our data and ablation of idiopathic ventricular arrhythmia. These are arrhythmias which arise from the outflow tracts, and they form about 90% of the idiopathic ventricular arrhythmias. And we talked about why is there a difficulty in ablation of these arrhythmias and why is there a second and a third procedure for the same patient. First of all, induction was a big problem. We touched on that and how to induce it in the lab using some special techniques in patients who have received sedation and where the arrhythmia is not appearing in the lab after the patient arrives in the lab. And once we are in the lab, we talked about the mapping techniques that will facilitate in localizing the arrhythmia to an area where it is easy to ablate. Now, the complexities of this ablation would be, what if the arrhythmia is located in a chamber with, in a location where it would be too dangerous to ablate, such as the left main coronary, near the left main coronary artery or the right coronary artery. We talked about the utility of cryoablation in these locations, giving much higher margin of safety. We also talked about that if a chamber shows too many areas as early areas, then we usually go and map the neighboring chamber, which probably is the location of the origin of the arrhythmia. We also talked about mapping unusual locations such as anterior interventricular vein as well as aortomitral continuity as the source of origin of arrhythmia if an ablation is unsuccessful. Now, lastly, we touched on an important issue that typically there's a 35 to 55 milliseconds ahead an area of interest would be found. If that is not found, or the ablation after about 10 seconds does not terminate the arrhythmia, then we usually come off of ablation rather than continuing ablation in that location, and usually search in the vicinity or in the adjacent chamber close to that vicinity. The Congress definitely provides an avenue for people who have done significant amount of research to come and publish the data. I heard about 600 delegates are attending from 50 different countries presenting their data, which they've worked hard over the years to bring it up here. So it is a very good location to exchange a lot of valuable information, as well as to identify areas of strength and weaknesses within your own program to rectify. So I think it's a good opportunity to meet and exchange knowledge here.